If you have a person you suspect has a head, neck, or spinal injury, you can open the airway using the jaw thrust maneuver. The jaw thrust maneuver allows you to open the airway without moving or tilting the head back. You lift the jaw up with your fingers along the jawbone. If you are not able to open the airway properly using the jaw thrust, use the head tilt chin lift maneuver to open the airway. It is more important to have an open airway for a non-breathing person than to care for the spinal injury. You would suspect a spinal injury when the victim complains of neck or back pain, tingling in the extremities, or weakness. The victim was injured, diving into shallow water. There is obvious head, neck, or back injury. The victim was an occupant, rider, or pedestrian in a motor vehicle, motorcycle, or bicycle crash, or the victim was injured from a fall greater than standing height. Some of the signs and symptoms include bruising of the head, especially around the eyes and behind the ears, blood or fluids in the ears and nose, seizures or changes in level of consciousness, impaired breathing, vision, or body movement, severe pain or pressure in the head, neck, or back. Now we will examine the jaw thrust maneuver in detail. First, firmly and securely place your hands alongside the victim's face. You want to be careful not to move the head or the neck in this situation. Your fingers will be placed at the bottom of the jawbone. Your thumbs will be placed firmly on the victim's cheekbones. To open the airway, you will press down with your thumbs on the cheekbones and lift up with your fingers on the bottom of the jawbone. Practice performing the jaw thrust maneuver. Remember, place your hands firmly alongside the victim's face. Your thumbs will be placed at the top of the cheekbones. Your fingers will be placed under the bottom of the jaw, and your fingers will lift up on the jaw while your thumbs press down. This will allow you to open the victim's airway without moving the head or neck.